Dr. Patel has been working at Southampton General Hospital for around 8 years, focusing solely on the treatment of diabetes alongside teaching professionals and patients about the disease. Now his efforts have been recognised, and as a result he's been nominated for a national award.
It's been such a big shock, and we're all very delighted and overwhelmed and excited about this nomination. It's certainly helped raise our profile in the last few days around the hospital about diabetes and who we are and what we do, and people have been very friendly, very welcoming and great, and I've received very lovely messages from both patients and public and colleagues around their happiness for me and my department. I've worked here as a consultant in diabetes since 2008. I'm mindful that over the years, internationally, the number of patients with diabetes is increasing. There will probably never be enough specialists to see all these diabetes patients, so my passion is ensuring that I can offer education to as many patients, public and healthcare professionals about diabetes as I can and my team can. We feel that diabetes should be a shared issue in terms of the education and management of diabetes, and the more confident people and patients feel in either looking after people with diabetes or managing diabetes themselves through having good education will give them more confidence to and inspire them to continue to do so and live well. In the country, it's believed somewhere between 2.5 and 3 million people in the country have type 2 diabetes. The NHS diabetes spend currently is £1.6 million an hour. That's true. And about 10% of the annual NHS budget for the country is spent on supporting diabetes.
Despite how common diabetes is, he says there remains many misconceptions that need to be addressed.
For example, type 1 diabetes is where patients have to have insulin, and currently type 1 diabetes is not preventable. Type 2 diabetes is chiefly a consequence of obesity and poor dietary choices and more sedentary behaviours. So gaining weight, being obese, makes your body have to work harder and become less responsive to insulin. So that type of diabetes can be prevented. A chief frustration for us is where patients get told they have mild diabetes. There's no such thing as mild diabetes as far as we're concerned. You either have it or you don't. And again, there's misconceptions around eating sugar causes diabetes. Whilst you might sound as if that's true, the actual reality is that eating excess sugary foods fuels obesity, which in itself then is the risk for developing diabetes later on. But what's equally important is that if there are patients at risk of developing diabetes, there are things they can do in their own lives, such as eating healthily and keeping more active, that can massively reduce their risk of developing diabetes in the first place. And again, good education underpins that awareness.
During his time at the hospital, he's also developed an app to help with bedside care.
Back in 2012, we recognised that a lot more medical staff using smartphones and applications. There are numerous diabetes applications out there to help patients. What there isn't many of is a kind of app that can help doctors and nurses manage patients in hospital with diabetes. So back in 2012 with colleagues, we came up with a smartphone application called Diabetes. And what this does, it essentially gives you a few points and support in making decisions for your diabetes patients. In essence, for example, we've covered issues around how doctors and nurses can get some guidance on adjusting insulin doses, how to treat low blood sugar levels, working out which diabetes drug is which, and some other general safety rules around using insulin, for example.
Dr. Patel is now in the final 3 for the award. The results will be determined by public vote and announced in October. April Brown, Solent News Now.